All right, we're back live again. Let's try now. Okay, so let me know if you guys can hear me or if the one person who's here can hear me, and if you can send your questions or any text messages on the chat. Okay, so if you guys have like a WhatsApp group, whoever's online, if you know they can share the link of this stream to the WhatsApp group, that'll be great. Okay, so the four people who are here right now, they can tell the other people that this is a new stream, and the reason is because, all right, let's see, how do I send this to everyone? Share. Thank you, Faraz, and I'm glad that the chat stream is also working. So we have 7 people online right now. Are we waiting for anyone else? Just let me know whenever you guys want me to start. Let's see. So I think there are like 6 to 8 people right now. They're coming and going. Let me know if you guys want me to start. Of course, this stream should be saved later on, and anyone who's not able to join right now can have a look at it in the future as well. Let's see, so that's 9. Right. Okay, so we can start off with 9, and of course, people can always join in as we move forward. So, thank you for the opportunity for this opportunity that you guys gave me to talk about interview preparations. I can, while I was thinking about this live stream, I was thinking about my own time. How long ago was it? Like 4 years ago now. I almost feel like a dinosaur. Um, and it was a very nerve-wracking time. I think it's important that before we really delve into your questions and before we start talking about what an interview really like, I think it's important to understand why you guys do need to be a part of the interview process. So obviously, this is for the match. This is specifically for internal medicine residents or aspiring residents, rather. Um, but anyone can join in because I think the information that we'll share or we'll talk about will be pertinent to people of every specialty. Um, so starting off this journey, there are a lot of filters that you need to go through before you even reach this point. I think that's important to understand, right? So you give USMLE step 1, test your basic knowledge. You give USMLE step 2 CK, that tests your clinical knowledge. Then you end up coming to the US, which for a lot of you guys is, it's like a new place, it's a new continent, new country. You're not talking in your first language. And you give USMLE step 2 CS, which tests your clinical skills. So it tests your history taking ability. It tests your physical exam skills, and it also tests for your documentation, right? You go through that process, and then you go for US experience. So that is a completely different set of skills that are required altogether. So you have to adapt to this new setting. You have to work with a mentor. You have to make sure they give you good letters. You have to show professionalism. So a lot of different skills are involved in that as well. The main idea is being a doctor is hard, right? Because it requires all these different skill sets that you need to use before you enter a patient's room for the first time. And I'm not even talking about going through medical school. That was a completely different ride altogether. So what I mean to say is that even reaching this point required a lot of hard work, and you guys should be proud of that. That you've even made it this far and gone through so many different steps to reach this point. The next barrier, the next mountain before you guys end up matching is, of course, the interview process itself. And I'm assuming your applications are now being sent or are in the process of being sent over. And programs are probably sitting down right now, going through those applications and seeing which ones they want to call for an interview. Now, why does a program want to call any applicant for interview? Well, the reasons are pretty simple. The reason someone would call you for an interview is basically to get to know you as a person, right? And to give you a snapshot into their program as well, so that mutually you guys can decide if that program is a good fit for you or not. Um, So before I start answering your questions, I think what we can start off with is we can just talk about the different steps of an interview process. And then we can deep dive into your question, because doing that, I think a lot of your questions will already be answered. And whatever's left, then we can talk about it at the end of this session. So the interview day doesn't really start off, in my opinion, when you go in for the interview. It actually starts off with the interview invitation, right? So when you get that email notification, when you get that notification in your ERS inbox, your interviews really start from that point. Okay, so there's the first thing that we need to take care of, is that our interaction, our communication with the program needs to be professional, needs to be courteous, and it's always better to reply to those invitation emails in a timely fashion. Okay. Uh, there are different reasons behind it. Number one, if you do it in a timely fashion, you're more likely to get the date that you want. And number two, it makes it easier for the program coordinators as well to kind of put you in a particular slot instead of waiting for you for days and for weeks, and they haven't heard from you. So the first thing I would recommend is that when you do get an invitation from any program, reply to that email in a timely fashion, for the reasons that we just mentioned. Um, Once the interview date is set up, the next thing that we need to work towards is figuring out how to get there, and where to stay. Some programs, especially in the smaller towns, the smaller cities, might provide you with accommodation in a hotel. But if that's not the case, then Airbnb is a great option that you guys can use. The other option can be reaching out to anyone in that city, maybe someone from the alumni group, and see if you can get accommodation through that. Because yeah, I mean, if you have a very small number of interviews, it might not be that big a deal. But if you have a lot of interviews, it can have a significant financial toll on you just traveling from one place to another. So it's important to be mindful about that. The second thing would be how to actually get there. There are different ways people use. You can book a flight. Usually, the earlier you book a flight, the better it is. You can use Amtrak. I personally never used, any of the train services, because they usually costed more, and they took the same amount of time. And the third option is using like a bus service, such as Greyhound or Megabus are the two most commonly used ones in my experience that you can use, and you get over there. So once you're there, another part of the interview process is actually preparing for the program. And I think any program, the hospital's website plays a very critical role into that. So before you go into any interview, whether you have 3 interviews or 30 interviews, I would recommend to treat every interview as your first and your last. Give it, utmost respect, give it utmost importance, because you might end up spending the next years of your life in that place. Um, so go through the website in detail, get to learn about the program, get to learn about the people who are over there. Sometimes, if you have a senior who is a resident there or an attending there, or anyone who's interviewed in that program before, it's always kind of helpful to talk to them as well, just to kind of get to know the feel of the program and what the program is like. So once you get over there, a lot of programs do host a pre-interview dinner. I would recommend strongly to go to that pre-interview dinner. It's usually not compulsory. It's conditional, but I would strongly recommend you guys to go over there. Someone asked me, what you should wear, especially for guys, and someone asked me if you should be wearing a suit and a tie. I would recommend against it, because then you'll be remembered as the guy who was wearing a suit at the pre-interview dinner. So it's usually supposed to be a very casual kind of a setting, where, and it can vary from, it can vary over a spectrum, right? So you can have a pre-interview dinner at a bar, all right, with you're with a bunch of residents, or it can be in a cozy restaurant in which you're like, it's just you or a couple of other applicants and then 3 or 4 residents. I think a collar shirt should be okay in that. Some people say that probably you should not wear jeans. I think that should be fine as well at times. or you can wear khaki pants. But generally, the idea of the pre-interview dinner is to uh, get you a snapshot into the program in a more casual environment. Use the pre-interview dinner to really talk to the residents about what they like about the program, what they dislike about the program. I used to use the pre-interview dinner mostly for really getting to know the city and the environment and the logistics and the transport, if you need a car or not, if residents live in apartments, what the cost is like, what do they do on their time off. Because on the interview day, you guys will realize that things are kind of so rushed up at times. A lot of your questions might go unanswered. So this is a very good time to do that. Um, Another thing would be, usually you would know where you're going. Of course, you'll know where you're going for the pre-interview dinner. What I used to do was I used to look at the menu beforehand, just so that I kind of have an idea of what I want to order. A lot of us have some dietary restrictions, so that kind of just going to the menu beforehand helps us out with that. At times, though, you realize when you're actually there, it's a completely different menu. They have like a preset menu for that for you, but that's just the way how it is. Um, so that's something that you can think about as well. And try to be punctual at the pre-interview dinner. Try to come at the time when you're actually supposed to come. And usually, the time to leave, you'll know when everyone is leaving. You leave from there as well. Once you go home from the pre-interview dinner, the night before is actually very important. It's almost as important as the day of the interview because that preparation is key to how successful you are during the day. All right. So try to get a good night's sleep. Get your clothes ready a day before. Know where you have to go. All right, because you're in a new city, you're in a new place. Um, there are high chances that you might get lost in the morning, and you don't want to end up late. Right, this is something very important. So you want to be punctual. So know how you'll be going to a particular hospital. If you're taking any of the ride-sharing services, make sure that those are actually there in the city. If you're driving, know where you have to park, know which building you have to go to, and this all comes. And if you're taking a folder with you, if you're taking any other things with you, get them ready the night before, and get a good night's sleep. That's extremely important. All right. So that goes into the prep of, and one more thing that when I mentioned about looking at the program's website, at the hospital's website, maybe just write down your questions. All right, because of course part of every interview would be what questions do you have about the program. So it's important to have those questions ready, and one way of doing that, genuine questions, would be when you go through the website and there's something that comes to your mind, maybe just write it down so that you don't forget it the next day. So then we come to the interview day itself. Um, it's very important to be punctual, but so for example, if the time of the interview is 8 a.m., right? Try to be there at wherever you've been called within like 15 minutes prior to 8 a.m. So let's say between 7:45 to 8 a.m. I think that's kind of a comfortable time to be in. You can get to the hospital a lot earlier just to make sure that you're there on time. Don't get there too early. I've done that and it was really awkward. I had this one interview in, I guess, November or December, in which I got to the hospital like 1.5 hours before I was supposed to be, and the coordinator wasn't there. Hell, the sun wasn't even out at that time, and I had to wait in the lobby, and the coordinator walked in front of me, and she was awkward, and I was awkward, and it was just weird. So it's okay to be early. Not that early, but it's okay to be early. But make sure that when you go to the room wherever you're called, it's kind of within that 15-minute range, because that's when they're expecting you. So it's better to fulfill those expectations. Usually the schedule is going to be out with you. They'll probably share the schedule either a day before or on the morning of the interview. You'll kind of get to know who you'll be meeting. If you get to know it the day before, maybe you can discuss it with the residents in the pre-interview dinner that what, I'll be interviewing with this person. What is their specialty? What are they like? Maybe they might give you some more insight about a particular area. For example, oh, this faculty member is also responsible for the program's website. So, if you have some questions about the website, then you can talk to that person. Or if someone says that, what, this particular faculty member is involved in resident wellness. So, that this is the person you can talk about you can discuss the topic of resident wellness with. So that kind of just helps you out on the next day. So usually, if it's like if you've been called for an interview on the day of the interview at like 8 a.m., usually starts off with maybe a little presentation. Some programs like you to sit in the morning report. Sometimes breakfast is served. You'll get some fruits, you'll get some bagels, sometimes coffee. Have as much as you want. Be comfortable, and then the interview process will start. How many people do you interview with? That really just depends on program to program. In some programs you'll interview with 2 people. In other programs you'll interview with 8 people. And there's no fit criteria for that. It just depends on whatever the structure of the program is, right? So some basic things would be, when you do walk in an interviewer's room, give a good, decent handshake, maintain eye contact, maintain a relaxed posture. Some of the common questions that they come across is, tell me about yourself. And that is really a personal question, and you can answer it in any way you want. One way of doing it is by dividing your answer into kind of a professional background and a personal background. You don't necessarily need to do that, but that's one way that people do it. Um, and you'll notice most interviews last for around 15 to 20 minutes. And you'll notice that, a lot of times you'll be the one who'll be driving the conversation. Seldom does it happen that the interviewer is going to have very specific questions that they're going to ask you. That usually happens when there's just silence, and when you've ended your answer and the interviewer cannot really pick up anything from your answer to ask you further, so they'll ask some of those questions. But generally you feel that within those 15 to 20 minutes, um, you'll be the one driving that conversation. um, Once you're done with the interview, they'll always ask you if you have any question about the program. Now, sometimes this happened with me in one interview. The first question I was asked was, do you have any questions about the program? And usually you expect this question to come at the end, but I was asked this question, just in the beginning. So you need to be prepared for that as well. Make sure that you have your questions ready. Not just because it's good to ask questions, but because you're interviewing in this place. You might spend the next 3 years. You want to know more about it, right? So make those questions genuine. And the best way to do that is by going through their website, getting to know about the program as much as possible. And there will always be some questions that will come out at the end that you'll want to ask the interviewer. Um, so sometimes you'll interview with the chair of the program. Sometimes it's going to be the program director. Sometimes it's just going to be a faculty member. Some programs like you to interview with residents as well. Um, you know, the basic pattern kind of remains the same. Another aspect of the interview day is the hospital tour. It's probably going to be a resident or a chief resident who's going to take you around the hospital. Um, Again, the idea remains the same, that you might be spending the next 3 years at this place. So take genuine interest in whatever they're showing you. I know, after 2 or 3 interviews, all the hospitals look the same because they are essentially the same. But you should just generally have interest in a place that you're applying to, and that, I guess, just goes on to show that you're interested in coming to that place. After you're done with the interview, the coordinator or the program director is probably gonna give you some contact information. Hold on to all the cards that you get from your interviews, all the contact cards, because that way you'll know who you talk to, and then that's probably going to be the end of the day. One good advice that I didn't do myself, but I heard other people did, was that after every interview. So if you have just 3 interviews, you just need one interview to match. Let me just make that clear. So let's say if you have 3 interviews, it's easier because there are just 3 programs, so it's probably not very pertinent to you. But if you, let's say if you have like 30 interviews, that's probably important and useful to write down the pros and cons of every program you interview at. Because at the end of the season in February, or is it March, when you're sitting down and making a rank order list, it's going to be hard to recall everything. So if you have that list of pros and cons of every program, that's just going to help you sort out your thoughts and make the best possible decision. The last process is post-interview communication, and I think it's just polite to send a thank you email to the people who called you for an interview, who gave you that opportunity to interview you with them. So I don't think there's any harm in sending a polite thank you email. However, let me make it clear, as per NRMP Code of Conduct, this post-interview communication should ideally not be affecting how you are on the program's rank order list. All right, and this is there on the NRMP website. You guys can go and search it. And I believe there was a study, I might be totally wrong on it, so don't quote me, but I believe there was a study about post-interview communication that, it does not affect the rank order list, but it does affect the rank order list for an applicant. So for example, if you send a thank you email to program A, and you sent a thank you email to program B, all right, in your head, both programs are kind of similar, but the program director for program B replies to you, just as a courtesy, you're more likely to rank program B higher than program A. And it's kind of discouraged as per NRMP Code of Conduct. And this is all on their website, so you guys can go and have a look at that. And yeah, that's about it. That was kind of the gist of everything. And once you're done with that, you go on and rank your programs. That's kind of a separate topic altogether. The programs are looking for the best possible fit for them, and you're also looking for best possible fit for you guys. And then this algorithm that kind of pairs programs and applicants together, and that's how you end up matching. So I think it was important to kind of give this brief structural overview of what the interview process looks like. I hope it answered most of your questions. I was sent a lot of questions by you guys. I think you guys sent it to Namreen. Let me just see which ones I can address over here. So let's see. So how do we describe our negative points to the PD and still make it seem like a reasonable thing? Again, so I won't be answering any of these questions for you, because these are all your questions, right? Everyone's story is different, and all these answers come from chapters of your book. It's not my book, right? So it's great that we have all these questions being discussed, but what I would want you guys to do is really do a deep dive and look into yourself and answer these questions for yourself now that you have some time, and think about these questions, because so that when you're asked these questions and when you're answering them, it comes out naturally because you've already thought about them. All right. So negative points to the PD still make it seem, yeah. So I don't think it's really asked as a negative point. It's more asked as a strengths and weaknesses question. It depends on what your weaknesses are. It could be something like, you don't take too much. It depends on what it is. There's no way I can answer this for each and every one of you. And I don't want, an answer that I give to be a standard answer for everyone applying from Dow, so that, wherever they're going to be answering the same way. And that's just going to be weird. But yeah, I mean, it could be anything. Look into yourself and see what is your weakness. It's important to know your weakness, right? Because that is the only way that we can grow, right? So the reason of asking you this question is to basically see if you have insight into your own personality, because having the insight is the first step for growth, right? Acknowledging having that weakness is the first step before you actually start working on it and you start growing and you start changing that weakness into a strength. So it could be anything like, maybe you don't take enough care of yourself. Maybe you don't give enough time to family. It could be just about anything. So the important thing is going to be to deep dive into your own personality and see how you can talk about that. Some weaknesses, I mean, if they're there, they would be hard to kind of say. For example, if you say something like love to lie, then it's going to be hard to find anything positive in that unless your program director is Rihanna, who loves the way you lie. But regardless of that, just think about this question beforehand and and answer it appropriately. How to tackle behavioral questions like how do I tackle some ethical dilemma? In fact, in all these years I haven't. Is it okay to say I have not, considering I just graduated? Yeah, so that's fine. You haven't been in practice, you haven't been a resident, you haven't been a practicing physician. It's okay if you haven't encountered any situations in which you haven't faced any ethical dilemma. So one important skill set of any doctor, especially internists, internal medicine physicians, is we like to communicate, right? So communication has to be a very strong point in our persona, right? So think about it this way: if you do come across any ethical dilemma in any patient management, the first priority is to keep your patient's best interest at the top. Everything comes after that. The first thing, the topmost thing that you're concerned about is your patient's best interest, right? Once you've kind of taken care of that, then the rest of the issues can be hopefully resolved through communication, through getting everyone on board. If you're an intern, you can communicate about your concerns with your upper ear. If it's your upper ear, you can talk about it with your attending, if you're an attending, or if your whole team is kind of stuck up with this problem. A lot of hospitals have a palliative care team that can be brought on board that can help bridge the gap between families, patients, and their healthcare providers. And a lot of hospitals also have an ethics committee or a legal department as well that kind of helps you out with that. So that could be one way in which you can answer this. What will I do if there's a person with, let's suppose, a problem? Yeah, so this is kind of a similar. So the question is, what will I do if there's a person with, let's suppose, a problem on which you are put on consult? Take acute abdomen, for instance. You don't agree with the surgeon for plan of surgery and think that medical therapy will be best. Yeah, so that happens a lot. It's not very uncommon to see this scenario in which the specialist or the consultant has a different opinion, and then again, the key remains the same: patient interest, number one, and number two, communication. Keep voicing your concerns. Keep discussing it. Keep discussing your concerns with the team, with your seniors, with other support staff, to make sure that everyone is on board for the mutual welfare of your patient. When should IMGs expect interview call? How much window do we get to schedule? Yeah, so I don't think there's any magic formula for this. I mean, you can get interview calls starting from the next day you apply all the way up to even the first week of February, I guess, or is it the last day of January, something like that. I think the first 2 weeks of October is kind of the time when most interviews or the first wave of interviews are kind of sent out. So I guess the first couple of weeks of October might be a time when you can start expecting, and even if you don't get interviews, that's fine, because interviews come in waves. And again, you just need one call to match. But that's kind of just my observation, that maybe the first couple of weeks of October is when you might expect your first interview to come in. That's kind of just a random guess. How much windows do we get to schedule our interviews? Yeah, so this depends on where you are and what the program is. I've scheduled my interviews 3 months in advance, and then I got this interview once in which I got a call at 4:30 p.m. that, can you come in tomorrow? I was in the city. I said sure. So there's no specific formula to this. How to answer what is the most interesting case you saw questions? Yeah, so I'm not really sure. I'm not really in like in an interviewing position right now, so I'm not sure what interviewers are expecting you when they ask you this question. I think what the expectation is just to kind of see what your presentation skills look like. It could be anything. It could be either interesting from like a medical standpoint, a case that you wrote up maybe as a case report, or it could be something that personally touched you and you made change in any patient's life. What's a thank you card? Is it just an email or do you physically write a thank you? I think we talked about post-interview communication. How frequently is it acceptable to email programs to view your application without coming across as being annoying? What about phone calls? Yeah, so I'm not really sure if there's a specific NRMP policy with regards to that or not. I tried to search for it, I couldn't really find it. So I would want you guys to really look it up and see if there's any particular policy. I don't think that contacting programs to review your application is an absolute no-no. Either things could be used. You can use phone calls or emails, but do realize that there are thousands of applicants. There could be up to thousands of applicants in any one program, and hence they could be getting thousands of emails, right? So even if you don't get a reply, if email gets ignored, that's totally understandable. And same goes for phone calls. If phone calls can totally go to voicemail, and that's fine just because it's such a busy time of the season. Um, I don't know, maybe once a month, once every 2 months is reasonable. But again, I would let you guys kind of delve into and look at if there's any specific NRMP, codes of conduct for that or not before I commit to my answer. Um, what's the appropriate dressing for guys for pre-interview dinner? I think we already talked about that. And let's see, what has been your biggest disappointment in medicine? So I don't know. You guys tell me. It's all a personal story, right? So uh, you guys haven't, all of you come from different backgrounds. Some have been residents, in some other country. Some of you are just fresh out of medical school, so it kind of differs on person to person. Physician burnout is a major topic of discussion everywhere, and there could be a lot of reasons behind that. I would suggest you guys should maybe read up some of those articles about what could be the reasons behind physician burnout. And if you've been feeling burnt out as well, ask yourself and see what are the reasons behind it. And that could be a really good topic of discussion, and it could even stem questions during the interview about, what, this has been my biggest disappointment, or this is what I was not expecting after entering this field, and what does your program do to kind of address this? And it could be a great topic for that particular interview session. What did you find hard in medical school? Again, it depends on what your experience has been. Tell me about a time when you made a choice that ended with a good result and with a bad result. So this could be either in a clinical scenario or it could be in like your personal life. A clinical scenario could be something that you did and led to a better patient outcome, or it could be some relationship that you established with the patient that led to better compliance or something like that. And a negative outcome could be kind of similar as well, but the effect was not as expected. But as long as we're reflecting on it, as long as we're learning from it, that's what's important for our growth. Tell me about a situation you had to work with you didn't like. How did you handle it? Yeah, so as I said, as physicians, as doctors, it requires various different amount of skill sets, all to be working together like a well-oiled machine. And one of those skill sets is communication and being able to work in a team. So I guess any situation that you describe in which you had some difficulty in, I think by using these particular ingredients, you can tackle that situation and get through it. Tell me what I think ethical dilemma, we already talked about it. Tell me about your best and worst residents or PGs. Again, you can, if when you're talking about best, you probably need to tell why. So you need to tell what inspired you from that particular personality. If you're talking about worst, I don't know, maybe it was something, some habit of that person. And then, of course, the next question could be, how did you deal with it? Um, and, if you've had any particular experiences like that, again, you should just ask these questions to yourselves and roll back the clock, all right, and think about it. This is a very good time for reflection. Yeah, this is one of the things with the interview season as well that makes you reflect a lot about yourself and about your experiences. So, if you've encountered difficult people to work with in your previous work environment, how did you learn from it is a skill that you've acquired, and you can use the skill moving forward, hopefully once you become a resident. Most memorable patient, again, could be a clinical scenario, could be a patient who personally touched you. Um, some tips on how to approach panel interviews. So I personally wasn't part of any panel interviews. So I'm not really sure if there's any specific thing. If I imagine a panel, I imagine like four people sitting, I guess some of the basic things would be maintain eye contact with everyone. When you're talking, try to address everyone. I don't think the rules would be too different from a one-on-one interview, except for the fact that you just need to pay attention to everyone who's there, so that you're addressing the whole panel instead of just one person. Those are my 2 cents about it. All right. So there's this question about a research LOR. I'm not really sure. I didn't have any research LORs. I think you can ask this question on the alumni group or someone who's attached that LOR in the past. I think it should be okay. But since I haven't used any research LORs in my application in the past, I can't really answer that question. Excuse me. If the rest are really good LORs, all based on experience 2015, is attached in the recent LOR. If I don't have the time to get a US doc one with an observership there, should I get one from a local doc, still recent part, or just attach the foreign doc ones? So this is from, you're saying that you have letters from 2015. Yeah, so I mean, that's tricky. First of all, you probably don't know what the content of the letters are because they're most likely waived. I think the more recent the LOR is, the better it would be generally. Um, Again, I wouldn't be so sure, and I would probably reach out to someone who has been in your situation in the past to see, if an LOR from Pakistan or from any other country carries the same weight as an LOR from the US, because usually when someone is seeing a US LOR, they know that they're from the same system. But if someone's done that, I would probably ask you to reach out to them. US citizens with really low pass USMLE scores, but an okay to good CV, what should be the strategy for matching into internal medicine? Can they still match into IM, and should they now apply to family? So, I mean, every application is different, every person is different, everyone's network structure is different, everyone's circumstances is different. So that is why you have the whole application, right? It's not just the scores. You have your CV, you have your research, you have your personal statement, you have your letters. That kind of all makes up the application. Um, so if this person has kind of low USMLE scores, a good CV, but has great letters, great personal statement, has been around, maybe doing some observerships, who knows, they might have a good shot at matching internal medicine as well. It says should they now apply to family medicine side. So here's the thing. So if whenever you go into a specialty, try to go in it genuinely. I know there's this concept of backup specialty as well, and it's completely okay to apply to multiple specialties, but make sure that you've actually spent some time in that specialty, and what the specialty feels like. You at least have some letters from there, or you've had some kind of clinical experience in that particular specialty. Because no one wants to get a resident on board whose heart is not really in it, because otherwise they're just going to be miserable for the next 3 years, right? So it's okay to apply to multiple specialties. It could be anything: family medicine, psych, peds, whatever, surgery. ENT, whatever. But just make sure that you have clinical experience in that, and you have maybe some letters to support that as well, which means that you would be genuinely interested being a resident as part of that program. All right. Do we need to reply to emails by programs? No, not necessarily. I don't think so. I think those acknowledging receipt of applications is just kind of a generic email. I don't think I got any, so I'm not really sure. But I would assume it doesn't change too much. I mean, if they're sending that email out to thousands of people, let's say 1,000 people, and they're getting 1,000 replies, I don't know how that's going to change anything. Again, I didn't get any receipt of application emails, so if someone did, you can maybe reach out to them. I don't think it should really make a difference, to be honest. When should we start emailing programs ideally, and shall we email program coordinator? I think we talked about contacting programs. If there's an NRMP code of contact that you guys can look up, that'll be great. And programs are still in the process of looking at applications throughout October. So maybe a little bit kind of mid-season to later in the season should be okay. But if you're not getting any interview calls, that should be fine as well. But again, for this question, I would ask you guys to see if there are any specific NRMP codes of conduct with regards to, communicating with programs, and take it from there. I didn't personally find any, but if you guys can, let your other colleagues know as well. Okay, how should we answer the program director? Excuse me. If he or she is asking in detail about visas and programs which offer both, like, why do you want H-1B? We can sponsor J-1 for you. So I'm not sure. I personally wasn't in, so I hadn't given my step 3, so I was kind of out of the H-1B equation anyway, so that question didn't really apply to me. There are a lot of differences and nuances to different types of visas, and I think someone who is kind of more well versed in this might be able to answer this question a little bit better. Someone who was asked this question might be able to answer this question a little bit better. I'm not sure, what the program director would be searching for when they're asking you this question. But I would probably reach out to someone who gave step 3 and went to a program that sponsored both J1 and H1B and was asked this question, because they would be the best people to answer this question, right? It probably wouldn't be me, because it wasn't really an option for me. All right. Do we have any other questions? I think those are all the questions that I got on Messenger. How and when should we tell them that we're thinking about couple match at the time of rank order list? So I've discussed this question with a couple of other people in the recent past as well, and I have like a very we have very kind of a extended document on the alumni group. I would let you kind of go into that and just read the whole document in its entirety. And after that, if you have any questions, feel free to reach out to me anytime. I don't think you're necessarily required or obligated to tell programs if you're pairing your list as a couple, because that kind of comes pretty late. That is when you're submitting your rank order list, right? Before that, the couple match thing kind of just comes at that time. So you can go through that document, and then if you have any questions after that, feel free to reach out to me. Shoot me a text, give me a call, whatever. I'll be happy to answer that question. All right, let's see. Green card message conditional. 1 for 2 years to expire and get gold program. See me as an unstable candidate. I have no idea. So the question is, I got my green card through marriage, so it's conditional 1. For 2 years till it expires and get unconditional 1. Which program see me as an unstable candidate? I don't know what an unstable candidate by definition is. I think it should be okay, and you should be in the same boat as any other green card candidate. Um, so again, I've never been in this situation, so I can't really answer confidently. But I think if you have a green card, then you fall under that category, and you'll probably treat it the same. I'm not really sure what an unstable candidate would be. Okay. Uh, if one person gets an interview and wants to secure that interview for their spouse, when and how should we ask the program about it? So, you know, uh, it depends if you're applying to the same specialty or not. Uh, Me and my wife applied to different specialties, and you can do it during the time of the interview. So if you're talking to the program director or anyone else, you can mention that you have a spouse as well who's applying, and if um, their application can also be considered. There could be programs that encourage couples matching. So these are the kind of things in which the pre-interview dinner is really important, right? Because in the pre-interview dinner, you can kind of explore these questions with the residents and see if there are already couples over there. Because if they have couples, it probably means that the program is couple friendly. So you can do it on the day of the interview. You can see how things go. You can see what the environment at the program is, and you can do it at that time. And how should we ask the program about? It can just be generally while talking to whoever you're interviewing with. You can discuss it with them. You can talk to them about it. Um, it could be part of what questions do you have. So this could be one of your questions, right? Um, as per NRMP codes of conduct, again, I would want you guys to go to that website and have a look. I don't think program directors are specifically supposed to ask you about your age, your family, your sexual orientation, you know, your religion, things like that. They're not specifically supposed to ask you these questions. But if you have a spouse who's also interested in that program, and both of you think that you'll be a good fit for their program, I don't think there's any harm in mentioning it to the interviewer so that their application can also be reviewed. Do we carry any documents to interviews? I think it's okay to kind of carry a file. I don't think you need any documents as such. Something that could be carry like a confirmation of your interview. You can carry maybe the address just in case you get lost in the morning. I think it's okay to just carry a copy of your CV as well, just in case the interviewer is sitting over there and they've lost it or they didn't print it out. Then you can just kind of hand it over to them to save some time. Um, but really, it needs to be minimal stuff. I don't. You need carry a form of identification as well. It could be a passport, a driver's license, whatever. So that that can be asked at hospital entrances, and maybe even at the time of the interview. Okay, how do you answer the question about childcare and moving away from husband? How do you answer the question about childcare and moving? So what would the question be? I mean, um, it depends on what the question is. It depends on what your circumstances are. It depends on where you're interviewing. It depends on where your husband is and where your child is. Um, so it totally depends on your circumstances and what exactly the question is. Okay, let's see. Okay. All right, so those are all the questions I've gotten so far, I believe, unless I have skipped any. Doesn't seem to be. How would you answer if you're comfortable with moving away? How would you frame the answer? Um, Again, it really depends on your personal circumstances. It it's important to kind of ask this question from yourself and see what the best possible answer is. Now, you are obviously sitting for the match, right? Excuse me. You've applied to a program that might be in a different city than your husband or your child, right? And if you're applied there, it means that if you match there, you'll be okay in continuing there as well, right? So there are pros and cons to everything, right? In this particular instance, the pros seem to outweigh the cons. The benefits seem to outweigh the risks. And you just need to sit down, maybe even jot down those points to see what the pros are and what the cons are, what the benefits are and what the risks are, and tell them to whoever's asking this question that, uh, these things go in favor, these things go against it, yes, but the things that go in favor of it, of me coming over here, are more and are more meaningful in the long term, right? So that could be one way in which you can frame the answer to this question. Okay, do we have any other questions? Walaikum assalam. How do we just house job experience? I think that's house job. Yeah. So again, it depends on what your experience was, right? Um, you can talk about the various rotations you were in. You can talk about the different kind of pathologies you saw. You can talk about the the number of patients that you saw there as well. You can talk about the hands-on experience. Um, you know, uh, it depends on how they kind of ask you that question. Um, so, civil hospital is a very interesting place, in my opinion, personally. I mean, I remember one of the professors who once said that it's really the mecca of medicine because you see so many different kinds of pathologies over there. I remember there was this particular case of tuberous sclerosis we saw as medical students in fourth year in our derm rotation. And the attending, the consultant dermatologist said that he called everyone, all 12 of us, and said, look at this patient. You're never going to see another patient like this in your whole life. This is so rare. And the next 2 years, we ended up seeing 2 or 3 more of tuberous sclerosis patients. So a lot of variety over there. Um, but then, of course, we know that the resources are limited. And so again, the answer just depends on what your personal experience has been over there, and how it has kind of shaped you into the person you are right now, and how you can bring those experiences to the table once you end up matching in that program as a resident. Okay, what if we say we have performed several bedside procedures like Foley catheter placement, blood sampling, and the PDS, they make you do nurses work? Like, we don't want to, no, so it's not, uh, I mean, it's, it's not about complaining, it is the way things are, right? They are short staffed, and it is sometimes part of your job description to do that. That is just the way the system is built, right? So blood sampling, for example, there might be hospitals in the US in which residents have to draw blood as well. So it all depends on the scenario. It depends on whatever the clinical situation is. It depends on what the needs of your patients are, right? If the patient needs that blood to be drawn, then someone has to do it. And if you don't have enough support staff to do that, then it ends up becoming the job of the house officer. That's just the way the system is built. We don't want to complain. Is it okay to mention negative? So it's not really a negative. I mean, there are a lack of resources. You're not complaining about it. That's just the fact of the matter, right? Um, yes, you don't want to complain about it, obviously, because I mean, to be honest, there's not much to complain as such because civil was a very important part of our training, throughout medical school. And I did house job, and house job was a very important experience for me as well. And those are the little bricks that end up making whoever we are today, right? So acknowledging that there are lack of resources, I think, is okay. It's not necessarily complaining. Um, so I don't think it would come under like a negative, uh, like a negative bucket as such. What questions can be asked about research publications? Um, they can just ask you about, tell me about this. If you've wrote a research paper and you've mentioned in your CV, they can just say that, tell me about this project that you spearheaded or you were a part of, or tell me about this case. Or it could just be a blanket question about, tell me about your research experience. And then, that gives you a good 5-7 minutes to talk about it, depending on, how much you have in your CV. Oh yeah, one other thing I forgot to mention is you guys should know your application inside out, all right? Inside out, because it would be really awkward for an interviewer to read something from your application about whatever you did, and then you're taking a minute or two to think about it, what it was. So you should know about, like, inside out about your application. So much so that in any single point that you've mentioned in your CV, you should have at least 2 to 3 minutes to talk about it. All right. Um, Also, another good tip is, if someone asks you a question, it's okay to give like pause for a couple of seconds, because it's okay to recollect your thoughts and make sure that you're giving a good answer instead of just rushing into answers all the time. So if someone asks you any question and tell me about your research, it's okay to kind of take a little bit of pause, recollect your thoughts, and then answer the question, because that just helps your delivery, and that just helps you answer the question in a better way. Right. Should we, what question do we, okay. Should we go through all our research papers right before the interview? So you don't necessarily need to like read up on every single word of every single paper you've written, but you should at least have a broad idea of it. I mean, you're not there to defend your thesis, right? But for example, if you've written like an original article, or if you've written meta-analysis, you should at least talk about whatever the conclusions were from those articles. Um, and just basically have a conversation. For example, if they pick up a particular topic, they might be asking you because they're interested in it. Let's say it's a gastroenterologist who's interviewing you, and you wrote a topic about GI. So that might be something that he might be interested in, and that's why he's generally, or she's generally asking you, and because they're interested. So I think at least knowing whatever the conclusion of your paper was is important. They might become even more interested and ask some more details. But it's important to know and be able to have that conversation at least for few to several minutes if you're asked to do that. Okay. Do we have any other questions? So, why did not start residency back home in the meantime? Um, Instead of an ordinary clinic job, I mean, it depends. It depends on whatever your circumstances was. There's no right or wrong answer to this. Um, why did you not start residency? And it's a question that you should probably ask yourself. And once you ask yourself, you'll have the answer. Then you can give that answer to the interviewer, right? It could be just about anything. It just depends on whatever your own personal circumstances are. Why do you want to pursue training in the US? Would you advise against discussing negatives of Pakistan's healthcare while answering this question? Um, Again, the reasoning could be different for different people. Um, Generally, it's advised not to be negative about your background or your previous employer in interviews in general. That's kind of just a general thing that is taught and that people talk about. Um, and the reasons could be several different. So again, I would ask you to ask this question from yourself now that we have some time. So as I said, this whole process is very nerve-wracking, all right, but at the same time it allows you to reflect on yourself a lot as well and really ask these questions from yourself, uh, and get to know yourself better more than anything else. So I would really advise you guys to take this time to ask these questions from yourself, because at the end of it, at the end of this interview season, you'll realize that you get to know yourself better as a person, not just your programs, but you yourself as well. How do we defend our USCs and yeah, so in other specialties? So I mean, of course, as international medical graduates, or um, our networking is limited in the US, and we usually want to take any opportunity that we want to gain that United States clinical experience, right? Because that is such an integral part of your application. So you got opportunities in other specialties. That's what was available, and that's what you took. That's how it went, right? So that could be one of the reasons why you did USCs and other specialties. Okay, guys, I think questions might have stopped. Again, I would like to thank you guys for this opportunity. I hope this session was helpful. And whatever I matched like 3-4 years ago, so it's been some time. So I don't know if some of this information is outdated or not. But feel free to reach out anytime. I'll be happy to answer any more questions. And at the end of the day, feel good about yourselves for even coming this far. It's a big deal. You've gone through so many hoops, and the match process might be favorable for some people, might not be that favorable for others. But learn from the experience. It's always the next time. And even if there isn't, you guys are all, you're all rock stars. So good luck. And then I think there is one more question. So could I just say that you'd also like to look into public health after fellowship because you're interested in it or better? No, that's okay. Having diverse interests is not something that will be frowned upon. If you're interested in public health, sure, talk about it. Why not? If that's something that interests you, whatever makes you look a real person, the better it is, because that's what we're all looking for. All right. Thank you so much, guys. Best of luck. And if you have any more questions, feel free to reach out. All right. Thank you.